conservation of energy. You were explaining that the occupational therapist, one of the key points of the program is to teach you to conserve your energy. You don't have as much, so how can you conserve it so you can actually stay more independent?
And do
so
the
that's
things
what
you
the
want.
occupational therapist is doing.
Yep, they have a wealth of knowledge about little tips and techniques to help to conserve your energy so that you're doing things more efficiently, and that means then that you're using less of your energy stores and your oxygen, the limited oxygen that you might have, to do things. And then that way you have more energy for doing the things that you want to do, playing with your grandchildren or going out to restaurants or whatever it is that you like to do.
Right.
So,
and in the that is a great picture of what we do in the outpatient setting, and to some extent what we do in home care. I do want to just mention for a moment our post-acute center for those who have been in a hospital or had what we call an acute exacerbation.
Yeah.
An exacerbation of their COPD, which just means a flare-up. It's a fancy word for a flare-up. And that's many times from a respiratory illness. You get a cold or you get the flu and you end up in the hospital, which is what we try to avoid. But it does happen where you need to go to the hospital, and then at that point you're a little too weak to go back home, right back home. So our rehab center, which is very well known in the area, our nurses and doctors and therapists work. They're there with you and working with you and overseeing your care 24 hours a day, and that is a great feature, I think, that we have it at McLean. And then from there, when you're stable,
So their job is to get you stable and start to educate you.
exactly. So if you can't go straight home, then you can come to the post-acute center, and then from there go home. And we cover 9 towns for home care and for hospice. So we are then able to send a nurse out to open your case and provide services in the home. And that includes nursing, includes a home health aide until you're stronger, so that they can have help with bathing and dressing and reminding you to do those exercises that the therapist has prescribed for you. And as well as the therapists really then tailoring the program that you were doing while you were in the post-acute center for home, and also working toward going outside, going to the mailbox, getting in and out of the car, and that sort of thing. And we also work closely with an oxygen company. And the oxygen company, not all people with COPD are at a stage where they need oxygen, but if they do need it, it's very, very important, and we would work closely with the oxygen company as well.
And we talked about the triangle and the 3 types of treatments that you have to have: the oxygen, if needed, the medications, and the therapy all together to really have a strong recovery program. And then you've got your zones that you're teaching patients about, of how to self-manage their own treatment. So if you can explain that, we're going to show that on the screen. So as Sarah explains it, you can see what she's talking about.
Yes, the zones, our nurses and our therapists are trained to educate our patients about the zones. And all it is a green, yellow, and red philosophy, where green, you're good to go. Everything's going along well. You're able to do your activities that you normally do. You're taking your medications as your doctor has prescribed. You're going to the doctor usually every 3 months for a checkup. And then you need to be aware that if you get into the yellow zone, yellow means caution. So you need to take action. You need to call. If you're active on services with us, we ask that you call our home care agency and talk to the nurse. We have a nurse on call 24 hours a day. And say, I started with a little bit of a fever. My cough's getting a little bit worse. I'm kind of feeling a little more tired than usual. we'll make sure that we follow through with making a visit out there, talking to your doctor, adjusting medications, adjusting your oxygen, whatever needs to be done.
Barbara was saying you could have some standing orders with the physician so that you can act immediately in terms of various interventions.
Right, because that's the thing with when you have some yellow zone symptoms, you want to make sure that you do take action quickly and not say, well, I'm going to the doctor in 10 days. I'll talk to him about it then. No, that's not good, because we're always looking to keep you out of the hospital. Keep your loved one at home. So letting us know when there's any change is important. Or if you are later and you're not receiving services anymore, calling that doctor directly. So that the red zone is when you're in true trouble and you really need to take action immediately in terms of calling 911, having your loved one take you right to an emergency room. That's important so that you are, receive medical care immediately.
And you've both talked about exacerbations, and when we met with the pulmonologists and we're going through extensive training, it was clear on their charts of COPD as you're managing your disease, and then you have these flare-ups, as I like the term flare-up, and that's when people are going back to the hospital. And we saw over time that with COPD, a lot of people are going to the hospital. They keep having these flare-ups. So what you're talking about with the zones is teaching people to get those warning signs early, know what they are, not ignore them, get the treatment, partner with the physician so that you're managing that and trying to prevent those hospitalizations, and again, keep their level of activity, because obviously if you get that hospitalization and end up in the post-acute center, your life is stopped. You're not having that independent lifestyle.
And all of our nurses and our therapists, we have some tools at our disposal, like you would have in an emergency room or in a hospital. This is actually a pulse oximeter, and this measures the oxygen in the blood. So, and the therapist oftentimes will use it either before and after activity to see how you're tolerating the activity, or even sometimes we'll leave it on your finger while you're doing an activity to see what progress you're making.
One of the main problems with COPD is that the air gets trapped in your lungs, so that you're not getting and that's used air. The oxygen has already been taken out of it, and it's used air. So what we want to try and do is to make sure that you're getting enough oxygen into your lungs that will get out to your blood flow. And if you're not getting enough oxygen into your blood flow, then that will show that your blood is not saturated with oxygen. It's important that generally speaking, that your oxygen saturation level is at least 90%. If it gets below that, then you're not getting enough oxygen out into your system. Your muscles aren't getting the oxygen that they need in order to function properly. Not just muscles, your nerves, your liver, your kidney, all of your organs need oxygen as their food or their fuel. If you don't have enough oxygen going out, it's almost like putting bad gas in your car. It doesn't run well. If you exercise and you don't have enough oxygen, your muscles won't get stronger. So it's important to have enough oxygen. So that's a
So you
that's
talked
a
about
valuable
posture.
tool.
You've talked about exercise.
Yep.
Now there's also breathing. You talked about how they can't get the oxygen. So explain to us what you're going to teach a patient, wherever they are, about breathing techniques.
There's a technique called pursed lip breathing, which is the whole...
Pursed lips, right?
Yes.
Pursed lips.
So the idea is to try and...
It took me a while to get this.
The idea is to try and get as much of that used air out of your lungs. That's the focus with COPD, is getting that used air out of your lungs. So you don't want to forcefully try and get that air out, as that just causes a collapse. What you want to do is to think about having a candle in front of you and just trying to lightly blow on that candle so that the flame just wavers slightly. So you just purse your lips, very evenly try and keep that flame just wavering. So the idea is that it helps to slow down your breathing and helps to get that air out, so that when you take your breath in, and that comes automatically, that's just a reflex. You don't have to work on getting air in. What you have to do is to work on getting that air out. So you take this nice breath in through your nose, because that's the most efficient way to get air in, and then breathe out. And the trick is learning how to do that not only when you're at rest, but when you're doing activities. When you're changing your position, when you're walking, when you're exercising. That's one of the primary focuses of what we try and teach people, is that correct breathing pattern.
This sounds good, but who pays for it?
Well, insurance does cover both if you qualify for a rehabilitative stay after a hospitalization. Your insurance and certainly Medicare will pay for that, and as well for home care. As long as you are requiring the skills of a nurse or a therapist, you can have home care in your home.
So you don't have to have been to the hospital to get the home care if the doctor recommends the home care.
That's correct.
If
That's
you're
correct.
homebound, you get it at home.
Or if you are you go to your doctor and they have put you on a whole bunch of new medications, and maybe now it's time for oxygen, and you're feeling a little overwhelmed. Say, can a nurse come out into my home and help me? And absolutely, we can do that, and Medicare will pay for that, and most insurances will. We have to get authorization like anything else, but it's usually paid for.
Right. So we've talked about 3 different areas that McLean can help people, but we've got one number to call.
The phone number to call is 860-658-3954. Would also like to mention, in addition to the subacute rehab center and home care and outpatient, is that we also have a wellness program, so that for people who can, who perhaps want to start a healthy lifestyle and improve their fitness, we have the wellness program, which is a wonderful resource for the community. Has a full line of exercise equipment, including a pool, and unique, I think, to our agency is that we have a physical therapist who will evaluate you before you started on your exercise program.
Great. And we hope that with many people who will come in and have the therapy under their insurance, then that they will go. The key we keep learning is, will you do it? You can do it. You can be more active. You can do these things, but will you? Because it's not easy, but you can change your lifestyle. And so the wellness program will, you will do it because you've got that support ongoing. And we find in the wellness program there's a socialization too, because you've got a bunch of friends that are going with you and working out. So it works as a team. So we want to thank you very much for watching this show. Please go to the McLean website, www.mcleancare.org. Call us, as we said, at 658-3954 to learn more about the Breathe Easy program or other ways that we can help you live a better life. Thank you.
Thank you.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.